And welcome everybody. Let me get our flag up. Okay, Becky, take it away.
All right. I pledge allegiance to the flag of the United States of America. Keep going.
And to the republic.
For which it stands, one nation under God, indivisible, with liberty and justice for all.
Had to find my unmute button.
Mine disappeared. All I could see was a flag. I didn't know where I was. Sorry, Becky.
No problem.
There's our mics when we need them.
Right?
Yeah. Okay. Besides our speakers today, I don't think we have any new guests. So I'll let you go ahead, Renee, with your announcements.
Okay, great. The Alzheimer's Association is having a volunteer kickoff meeting this Wednesday, the 5:30 p.m. This will be a virtual event. You can sign up at alz.org/NorCal, and that's NORCAL. This Saturday is Library Day from 10 to 7 at the Vets Building. Stock up on books and get a takeout dinner from 5 to 7 p.m. Also on Saturday is the Fortuna concert series performance featuring the Humboldt All-Stars. So they are back. This will be their second presentation since COVID. So that's great for them. Speaking of COVID, there's free COVID-19 testing at Redwood Village next to Dollar Tree. You can register for a free test at reg4covid.com. Lutheran Home for the Aging will have a groundbreaking ceremony on March 23rd at 10 a.m. for a new 8-unit complex, and the public is invited to attend. Our Grow with Google webinar that was originally scheduled for tomorrow at noon has been rescheduled for the 22nd. You can still register for that event on our online calendar at fortunachamber.com/events. And then finally, next week, our speakers will be the Department of Health and Human Services. And with that, I will turn it back over to Bailey.
Thank you. Announcements from our members. Does anyone have anything they'd like to share?
Well, I'll share something since Merritt isn't here. I was going to have our city manager share this. Bird scooters have been deployed.
Oh, I was going to ask about that. I saw them this morning.
Yeah, still there. I think there's 5 or 6. I don't know. I couldn't tell on the app. So if you have been jonesing for a ride on an electric scooter, now's your chance. Just download the Bird app from the Google Play or Apple Store, and you're on your way, and pay with credit card, and you can zip around town. They're super fun. And there is a city council meeting tonight too. If Merritt pops on at some point, maybe we'll turn the floor to him because I don't have the agenda memorized, but it's at 6 p.m. and you can access it through the Zoom link on the agenda, or you can watch it through Access Humboldt on your local TV station or on YouTube. And that's all I have, unless anybody else has any public service announcements.
A quiet group today. Okay, well then I guess I'll let our guest speakers, and Barbara, I'm sorry, I do not know how to pronounce your last name. But we have Barbara, the director of Redwood Coast PACE, and then Emily Stoller, the outreach marketing director.
Hi, actually, it's not too hard. It's Barbara LaHaie. And we're really excited to be able to be here and just get to know all of you. I think you know that we've had services, the Humboldt Senior Resource Center has had services down in Fortuna, but we're really excited to talk about the new PACE Center. So I think Emily's gonna put some slides up for me, and we're gonna kind of work together. So here's a picture of our building here. It's in the Gene Lucas Center. We hope that we'll be able to do an open house soon. We opened this center during COVID, so it will have its 2nd birthday in July. But we have been surviving through this time. So Redwood Coast PACE has 2 locations, the one here that you see in Fortuna, and then one in Eureka. Redwood Coast PACE has been in Humboldt County for 7.5 years. PACE actually started in San Francisco over 50 years ago, and it's nationwide. So this isn't just a Humboldt County program. This is a nationwide approach to healthcare for our elderly population. So the PACE, the acronym is Program of All-Inclusive Care for the Elderly. And we often describe it as kind of a whatever it takes, a wraparound program to do what we need to do in order to keep seniors in their communities and seniors in their homes. It's a health plan, and as well as it provides, we're also a service provider. And really, like I said before, the goal is for us to keep people safe and healthy in their homes. So there is some criteria for PACE programs. And again, this is the same criteria throughout the United States is you do need to be 55 and older, although there is some legislature that's being put forward for that age to decrease. We require a nursing home level of care, which is kind of confusing, and I try to have folks not worry about that too much. The state reviews potential participants into the program, and really what they want to see is that without the PACE services, this person could be at risk for a skilled nursing level of care. So they're looking at chronic health conditions, and those can be, you know, one or more chronic health conditions. Very commonly, we have COPD, but we have hypertension, diabetes. So, you know, not, and we certainly have had participants that come into our program with cancer on dialysis. But essentially the state's looking at this is an individual who has some chronic health conditions that without more intervention could be at risk for being put in a facility. Okay, you're going. That's okay. So Redwood Coast PACE, we are licensed by both the Department of Healthcare Services and CMS. And so that's the Medicare and the Medi-Cal. And that's what happens is we get a capitated rate. They come into our program and they end up with a PACE medical card because we are the insurance provider. So PACE allows people to live at home for as long as they can, safely and medically possible, maintain their independence and dignity and quality of life. We coordinate their health care, so our participants actually have a little calendar and a schedule. So any medical appointments that they have or home care, we cover that and make sure that they have their transportation. So we're a pretty intensive program, and I think that really helps peace of mind, both for the participants and their family and friends. They are able to access care 24 hours, 7 days a week. So maybe different than my provider is if I'm not feeling well on a Saturday, I'm going to need to either assess if I really need intervention, and I would end up either in the ER or say at urgent care. And we actually have our medical providers on call to our participants. So they're able to call and talk to a nurse or a doctor 24 hours, 7 days a week, as well as their family members can call. And if needed, our staff can go out after hours and on weekends, or they can assess for whether or not indeed this is a situation where people need to go to the ER. We don't want people in the ER that don't need to be there. So it really is helpful that we have the staff that can go out and maybe prevent them from going and waiting for hours and hours in the ER. This has been really beneficial under COVID, obviously. So here's our wonderful team, and this is a team that's required for us to open a PACE program. Every team needs to have a dietitian. The team needs to have OT, occupational therapist and physical therapist, a speech therapist. Every program needs to provide in-home care, primary care. We have a clinic at both sites. It looks a lot like your doctor's office. We have an activities specialist coordinator. We have nursing. We have master's level social workers, and we have transportation. This team actually meets every morning to talk about any concerns or issues that have come up with our participants, as well as doing care planning. So it's a very, very intensive, moving team. So here's the services that we are required to provide. Like I said, each of our sites has a full clinic. It also has a full gym for people to get occupational and physical therapy. We have nurses and social workers, as I shared before, but we also cover whatever additional health services they need. So that would be specialists. It would be, sometimes our participants have to go out of the area. We provide all the medications for our participants. One of the things I think that we've learned since we opened is that, boy, having home care is really important to having people live safely at home. A participant may need assistance in meal prep, light housekeeping. They may need more intensive services such as dressing or bathing. And really that's kind of one of the key services that really helps them stay at home, in addition to really our center services. We provide transportation to all of the medical appointments, and that's been really helpful to families who are stuck with taking a lot of time off of work. The fact that they can kind of turn that over to us is really a big piece for them to just be able to support their loved one being able to live independently. So this is our day center in Fortuna. It's absolutely beautiful. We are so thankful that the community supported us coming here. We actually have an outside area, so it's really great. They can go and play Frisbee golf and badminton or whatever they want to do. It's really special to have such a beautiful center. It was designed for PACE. And it just is really nice. The gym overlooks the outside, and we can see ducks and all kinds of stuff. So our participants, the first day we opened, they came off the van and said, "Oh my gosh, we feel like royalty. This is really for us. You did all this for us." And it was a pretty special day. So we really like people to come into our center as much as they can. Under COVID, it's been really difficult, and so we've had to limit the attendance. But we, at this point, bit by bit, are bringing participants in. They can come in the morning and have their coffee, tea, or hot chocolate and snack and talk with other participants. We have activities that go all through the morning, whether it be karaoke, trivia, bingo, you name it. And generally there's an exercise schedule, and they can go into the gym and gain their strength, and then something outside as long as the weather permits. And it's just we've had best friends develop in the center, and we've had a couple of couples that have met over the time that we've opened. And so it really gives, in terms of reducing isolation, it really helps them to feel like they have additional support in a whole community that they can come in and be a part of. So we're excited about, as the pandemic, improves, being able to bring more of our participants in. And as I said before, here's the fireplace, but if you were to go to the right, we have a full clinic, and then to the left would be our gym, and then also with our staff offices. So how it works, each of our participants have a care plan that they come to us and say, "This is what I'm interested in doing. These are my goals." And the interdisciplinary team that I mentioned before, with the nurses and social workers and dietitian, all come together and work with the family and the participant to develop a plan that everybody's comfortable with. And then we basically set goals and work towards making that plan happen. All of the healthcare, the primary healthcare, is provided at the center. And so when they come into the center, they will have a clinic right here. So if they're not feeling too well or not looking really well, they're able to get those services here. And I think that's it, Emily, if we could. And so you can contact us. Here's the phone number, and obviously that address is for our site at the Eureka at the Eureka site. We're pretty excited. The other thing I think I didn't mention is that all of our staff also do home visits. So while we really enjoy people coming in here to the center, we also provide our services in the home. So we are just kind of meeting the participant and their family members where they're at. We have 232 participants in our program, and 32 of those are here in Fortuna. And we are continuing to grow and expand our services. So I'm not sure if anybody has any questions for either Emily or I.
Quiet group sometimes. I guess I could ask a question. I know that the Fortuna, and maybe I'm speaking out of school. You can stop me if I am. I know the Fortuna Senior Center, they're building a new location, and the spot that they had occupied at the GLC are still occupying until they get their new space. Are there thoughts of expanding what you guys do into that area?
Yeah, I think as a part of the Humboldt Senior Resource Center, I think you guys are aware that we provide meals and activities. We have adult day health. We have a brand new behavioral health program. So yeah, we will continue to expand here in Fortuna, and that might involve using some of that space if it works.
Great. And then if somebody wanted to enroll, maybe I missed it. Do you bill Medicare? Is that how it gets paid for, or are the services free and then it's federally funded? Sorry if I missed that part.
Yeah, no, I think so. Most of our participants have Medi-Cal and Medicare, and they turn that over to us, and then we give them a PACE card. If they don't have Medi-Cal, we help them to get on Medi-Cal, and we also have community members that say, "I'll pay privately," because if you're on call to me 24/7 and they can see a doctor immediately, and they can go spend a whole day at your day center. So I'm not feeling like I need to be concerned about them being alone in their house. We have had community members say, you know, this is great. It's a one-stop shop. And the stress that we've had to try to make sure that we stay up on the care, provide the transportation and the home care. So we do have people who do private pay.
That's wonderful. That's great. All right. Anybody else? Questions, comments? No, good. Awesome. Well, thank you, Barbara and Emily. I really appreciate it. We're so glad that you're able to get things going again. And I look forward to more stuff happening in Fortuna and get more participants coming and engaged with our senior population. So that's great. Thank you so much for being here and telling us all about it. And we will see you guys next week with the Department of Health and Human Services. So enjoy your week, and we will see you next Monday. Bye, everybody.
Thank you.
Bye. Thank you.